Let's talk about what is evidence-based policies and practices or treatments. So an evidence-based policy, practice, or treatment means that there is sufficient research evidence that a positive effect can occur by using whatever it is that's being tested. And what's important here is the concept of sufficient research evidence, which generally means that we're talking about more than one study. Generally, we're trying to look at the body of literature, and it's debatable what's considered to be sufficient, but we tend to use in the criminology field around 10 studies. There's also the concept of evidence influenced, and that means that there is some clinical guidance and some research that can substantiate a positive effect. And what's important about the evidence-informed or evidence-influenced is that it really tries to integrate some of the clinical guidance along with some of the research studies themselves. We're going to first begin by looking at those that affect policies and practices in the criminal justice system, as well as in the behavioral health system that directly works with the criminal justice legal system. We have an article that is available. You can get it off of the PubMed, and therefore it's accessible. But this article details the information provided. So here are the evidence-based practices that are either offered in the criminal justice or legal system or in the community. In our study, we essentially found that 27% to 42% of the counties offer at least each one of these approaches, and that counties that had Medicaid eligibility enhanced the number of approaches that are evidence-based, and also enhanced the number of approaches that had to do with substance use treatment. What we're going to do now is we're actually going to dive into the 28 criminal justice and community-based practices that are offered in the counties and look at the effectiveness of these particular practices, as well as looking at some of the characteristics. So what you have at the top level is the sequential intercept model, and then down below, you basically have the list of different types of evidence-based practices that we're going to be addressing here. The ones in green are essentially the ones that there is more evidence support, so they fall in the evidence base. And the ones in blue are those that are evidence informed. So diversion or deflection, there's a new terminology that has emerged, which is basically differentiated between deflection, which are practices that basically remove people from any criminal justice or criminal legal involvement, versus diversion, which diversion usually occurs after an arrest, and essentially there's some formal processing of the criminal legal system that actually occurs. But these replace the actions by the criminal legal system by giving people access to treatment services. So you can see in this chart here that we've identified the key components of effective diversion deflection programs, and then we've identified the findings. So what we know best is that programs that provide clinical services, those programs are more likely to be effective, and they're more likely to increase access to clinical care so that people can initiate treatment and engage more in treatment. But there's a lot of potential benefits, as you can see by the findings: reduced involvement in the criminal legal system, increased employment, better outcomes for minority members. And essentially, this model provides a way of basically handling people with behavioral health issues where you can avoid much interaction with the criminal legal system. Mental health courts. So everyone's heard of problem-solving courts, which are specialized courts that attend to needs of individuals. These particular courts usually are about treatment, testing for drug use, and rewards and sanctions. They're usually involve a judge, and they're usually involved with a coordinator or personnel. All RISE basically has identified 10 key characteristics, and they include things like screen for mental health needs, provide mental health treatment, provide medications, and engage in medication management. The findings are positive here. There's a small to moderate impact for mental health courts on reducing recidivism, and there's more engagement and treatment when the services are part of the court process. Permanent supportive housing for individuals with mental health conditions or people who have housing stability issues. One big question always is should the criminal legal system deal with social support or social stability issues like housing? And it's clear that when you can provide housing, the housing can address the health or behavioral health needs of the client, and the housing can actually be a factor to reduce homelessness, to improve housing stability, decreasing ER visits and hospitalization. And when people are housed, they tend to have stronger client satisfaction. Key component here is that the housing should be offered without any real attention to making sure the person is clean or able to care for themselves. The housing should actually be able to be offered so that the person can begin to get some stability. Integrated mental health and substance use disorder services and programs. There's been a long debate in the field because mental health services are usually offered by a different agency than substance use disorder services, and therefore people had to be duly enrolled in different programs. But the notion of providing integrated care, which makes sense because of the high prevalence of people with co-occurring disorders, is that you could provide integrated care that addresses both substance use issues as well as mental health issues. The key components here are you have the same clinician, you have the same program, you can use some of the effective treatment practices, and you essentially have the opportunity here to provide case management services for supports for housing, employment, and family issues. The findings right now are, and this is why it's in the evidence-informed bracket, is that there is some findings that show that these integrated programs reduce depression and anxiety. There are some other findings that find that there aren't outcomes yet in terms of treatment retention or substance use or overall functionality. But the general gist of the literature is that if we want to reduce the burden of people having to manage multiple programs, that this is a model that's worth considering. Assertive community treatment or forensic community treatment. Assertive community treatment is a type of case management services. It's usually provided for people involved in the criminal legal system with the expectation that they'll be able to address both the social needs of the client as well as the needs related to their criminal behavior. The general findings are here that there is a modest reduction in homelessness. There's a small impact on psychiatric symptoms and severity. There's a small impact on treatment retention. There doesn't seem to be any real impact on criminal justice outcomes. Supported employment, and the notion is that you really help people get and acquire jobs and maintain jobs. You put people in employment positions. That also gives them assistance to manage the stress on the job, but also to deal with some of the social skills needed to function in the workplace. These are positive findings where you have higher rates of competitive employment, fewer days that it takes to get to the first job, longer retention, and higher wages. It increases the level of employment and the length of time of employment. What's important here is that the supportive employment can deal with the employment, but it also can deal with some of the other services that people often need, such as housing support, some of those soft skills that are necessary to be successful. Co-responder models, which are usually the integration of police and some sort of social worker teams to respond to calls for services or incidents that involve people with mental health issues. These co-responder models are increasingly using peer navigators after the initial incident to maintain contact with an individual and to be able to help with some of the follow-on care to reduce other instances of mental health crises. So there are a number of very positive benefits that can occur. There's behavioral health findings, which is giving people more access to care, providing more opportunities for follow-up, and decreasing hospitalization. There's also criminal justice findings that include decreased likelihood officers will use force or lethal force, better use of police officer time, and reduction in citizen injuries, and improved police understanding of how to deal with these crises and when an arrest is needed and when an arrest is not. The mental health peer navigator system, and those typically are people with lived experience who are in recovery or they've had some sort of mental health condition themselves, and they support individuals. What's advantageous here is these can be certified and therefore people can get employment by having this type of position. It inspires hope that people can and do recovery because a client is working with someone who has walked that walk. And so that can be a very positive aspect for individuals. And it provides all sorts of ways of dealing with myths that occur about substance use and mental health issues. In the mental health field, peer navigators have been used more predominantly than in the criminal legal system. And there has been literature that basically talks about improvement in self-esteem and confidence, a better sense of control and ability to make changes, improved empowerment. So you can see a lot of advantages here. And, from the criminal legal system, the studies are soon to come out that look at what are some of the advantages of using peer navigators. To go along with the peer navigator system is crisis call-in centers. So these are centers that basically people can call in to request services or to address crisis statuses. They are also services that are basically allow people to call to get access to mental health services. They can be independent or they can actually be part of emergency response system. So far, we're learning more about these sort of crisis centers through the 988 initiatives that have occurred over the last couple years. And most studies basically have focused on what happens at the end of the call. But if you think about the peer navigator and the co-responders, having these sort of crisis call centers is a good way in your community of being able to have a cadre of services that will allow for more access to treatment instead of reliance on the criminal justice legal system. Critical time intervention or case management. So within the research literature, there is something called the critical time intervention initiatives, and these are activities that are mobilized at some point in a person's life, usually at some transition point. So these studies have basically been used with people who are veterans or people who have unstable housing, likely to be used for people at different transition points as people are leaving jail, or they're leaving prison, or they're leaving a psychiatric facility. And essentially, the findings are that they tend to be associated with lower probability of arrest and a greater likelihood of engaging people in treatment services. So the notion here is that you provide the service at the point of transition. It's really designed to decrease some of the anxiety that occurs as people move from one setting to the next. It's basically allows for the ability to really individualize the care to that particular individual. Within the therapeutic literature, there is this notion that a good working alliance between the therapist and the client is healthy, it increases the trust, and the client fares much better. That same logic has been tested within the criminal legal system in a number of studies. We basically find that when a client feels comfortable, trusts their criminal justice staff, they feel that they're being treated fairly, and that they feel that the criminal justice staff care about them, that you tend to have better findings overall. So this therapeutic alliance concept is applicable and very relevant to staff who work within the criminal legal system. It is part of the evidence-based supervision model, which is that you develop a good working relationship with clients overall. There's a lot of discussion about continuums of care, and one particular one is the coordination of people between jail and the community, particularly around providing continued care for medications, mental health services, substance use services. So the notion here is that what starts in jail continues into the community, and that can be done in various ways. It can be a light touch, like helping people set up appointments, so when they leave the community, the mental health appointments or medications are already readily available for them. Or it could be an actual linkage in which there is, a transition, or the healthcare provider is actually involved with the person when they're in jail and then move into the community. We know there are a lot of benefits that come from this transition in terms of improving public safety, reducing psychiatric symptoms, reducing hospitalizations, relapse, suicide, and rearrest. One of the suggestions here are that people should actually really develop these coordination services. And there's a lot now that can be done with technology as new ways of thinking about some of this coordination of care. Something that's also talked about quite a bit is the cross-training of staff for people who work in behavioral health settings and criminal legal system settings like jails. So there's a lot of benefits that come from cross-training. One of them is a focused awareness of what are mental health issues and what are the appropriate responses. Other benefits that actually can occur is the criminal legal system and the behavioral health system can develop better relationships between them that basically fosters more quality programming. So these cross trainings are very useful and provide a means by which people can share information about their organization or processes, but they also provide opportunities for new initiatives for the teams. Family caregiver education and support. This is an area that actually people struggle, jurisdictions typically struggle with trying to provide, but here you're working with the family or support system of the individual to help them learn how to deal with some of the issues that come from having a mental illness, come from being involved in the criminal legal system, and help to prepare these support systems to be better resources and to be able to know what to expect. We have long recognized how important support systems are for individuals, But here, what we really want to do is we really want to prepare the support systems to be able to work better with the individual. So studies have essentially found that social support systems are very beneficial for the caretakers themselves. That reduces depression, it reduces some of the anxiety. It helps people to better understand how to handle situations. And there's benefits for the individual overall, because a stronger support system can really help someone be able to function better and also to be able to manage their recovery better. All of these programs are individual programs, but the programs essentially need supporting policies in order to be effective. And those supporting policies go from, having standardized screening and instruments, better referral and linkage strategies, better treatment placement strategies. So those are functional operations that organizations can have, all the way to making sure that you have the ability to pay for these services. Now, actually, Medicaid coverage and the 1115 waivers on Medicaid, which are designed to really provide care when people start in jail or prison and continue into the community. All of those ensure that you have some of that funding available to be able to provide these quality of care. Another important supporting policy, though, is to have performance measures that you can look at how your system is functioning. Finally, we need services that have to deal with moving people as their stabilization occurs, where you can step down the level of care or step up the level of care if someone is in distress or needs more services. So you have to think about your supporting policies.